Welcome to the Stanford MBA two-generational wisdom bridge across 30 years. I'm your host, Catherine Keogh McLennan from the MBA class of 1995 of Stanford. In each episode, I bring together one of my classmates, now in our 60s, give or take, and a member of the class of 2025, now in their 30s, give or take, and about to graduate into an entirely different world than we graduated in 1995. Back then, we finished our MBAs just as the internet was emerging. Today's grads are stepping into a future shaped by artificial intelligence, uncertainty, and we hope that we express possibility. These conversations bridge generations, share lessons, and spark reflections on leadership, life, and what's next. Let's dive in. Today, I'm joined by Laura Zung from the Stanford MBA class of 1994 and Shelly Ngo from the class of 2025. Laura is the CEO of Lancaster Health Group, a family-owned business that operates skilled nursing and Alzheimer's care facilities in the Chicago area. Over the past 13 years, she has led the company through transitions, expansions, and most notably the pandemic, where she worked tirelessly to protect her staff and residents. Her story is one of resilience, adaptability, and human-centered leadership. Shelly is a second-year MBA student at Stanford GSB, driven by a mission to improve healthcare access and affordability. She has experience in healthcare strategy consulting and has worked at a regional Blue Cross Blue Shield organization where she launched and scaled an insurtech venture. Now she's stepping into a new role as chief of staff at a seed stage startup leveraging generative AI to transform hospital back office operations. Her journey is fueled by personal experiences and a deep commitment to equity and innovation in healthcare. In this conversation, we bridge the 31-year gap between Laura and Shelly's perspectives, exploring how healthcare has evolved to what leadership looks like in times of crisis and rapid technological change, and what it means to keep the human element at the heart of our work. Together, we reflect on the lessons of the past, the promise of the future, and the enduring power of connection and compassion in the healthcare industry. Okay, we've got Laura and Shelly today. So honored. Shelly, where do we find you today?
I'm dialing in from the Bass Center and the GSB campus. So
we don't even know where that is. Tell us what that is.
Oh my gosh, it's the new campus. I always forget that.
Yeah.
Things shifted a little bit in the past couple of years, but it's the main library where all the GSB students half study, but also just half mingle around and chat with everybody. So I'm here in Palo Alto the last couple of weeks of school, just kind of enjoying the environment, soaking in the energy, and making sure we get the most out of our last couple of weeks.
For our audience, Shelly's getting ready to graduate, and I'm going to come back on that because it's a really interesting time. Laura, where do we find you? Where are you this lovely day?
It's a beautiful day in Chicago. I am in my office and overlooking our backyard because I work from home. It's our first day of summer. It's our first warm day.
And what's warm?
About 85.
85. Hey!
Sorry to keep you inside. We'll make this enjoyable.
Go Chicago! Go Chicago! Shelly, where did you grow up?
I grew up in inner city Los Angeles, so actually East Los Angeles. It's called Highland Park. So I'm a big fan of California and the weather, and really happy to be back. I went to school on the East Coast, and absolutely right, the weather is such a bummer most of the year. So it's been a good homecoming.
Let's go back to that graduation. So you have been at Stanford Business School for 2 years. You're getting ready to graduate. Laura, as I mentioned before the podcast, Laura and I lived with 5 women in Atherton in the same house. And I remember every day of the 2 weeks leading up to graduation because it was so precious. You suddenly realized what you were going to miss. And so what are you feeling right now, Shelly?
It's been a slow, impending feeling, a feeling of impending doom. Just kidding. But it's been hitting me for the past 2 quarters. I think just trying to make sure I get the most out of my experience and making sure I get to do what I want to do. And most importantly, making sure I get to spend time with the cool people that I have around me before we all disperse into the corners of this country and beyond. But I had a great last couple of weeks. I was able to do a talk. I don't know if that tradition was started yet when you guys were there.
No, tell us about the speaking thing.
It's very cool. It's a very treasured tradition on the GSB campus, and every we gather into a classroom, and two people who are selected via lottery get to present a 25-minute talk about their life, and you can do whatever you want with those 25 minutes. It's yours. You know, some people choose to get really vulnerable. Some people get to reveal aspects of themselves that we wouldn't have known about, and it's always super special. You get to know your classmates better in so many different ways. Or if you attend, we like to attend, we tell everyone to attend all of them. So people you don't know, then it's a special peek into their lives. And then at the end of it, like there's an outpouring of love and support, and the community is just really special. And so I got the chance to do that, and it's awesome.
Tell us a little bit about that, because it's like the grand finale. So what did you present?
I presented this Wednesday. And it was really great because I feel like, over the course of the past 2 years, you have met everybody, but, over the course of 2 years, perhaps with most people, you've only had the opportunity to spend like 1 or 2 hours with them in total, if you count up all the minutes. And that's simply not enough to get to know someone. And so I felt really good getting to share my story. I have a little bit of a kind of an alternative path. I grew up in inner city Los Angeles, primary low income, primarily Latino working class community when gang violence was at an all-time high back in the past. And it was a tough road to college. And so I got to share my reflections on what it was like, and, getting to Harvard and what that experience was like. And then my mom also had got cancer in the middle of that and passed away. So I took some time off school, and that led me to my path into healthcare, which I know both of you also have worked in and are still working in, Laura. So it was really special to have that, particularly at the end of the year.
Does it get recorded?
It does. I have a video of it for sure.
I'd love to watch it, Shelly. I'd be honored to watch it.
I also had the chance to do a low keynote. I don't know if that's a thing that you guys
No, tell us about that.
It's kind of another tradition where they give selected students, a chance to do a 9-minute TED Talk style talk to the community. This is our mini kind of TED Talk series, so I got the chance to do that. I spoke on a topic on healthcare as well, so that was really special.
The audience for that, Shelly?
It's Stanford community and beyond, so it's on the Stanford YouTube page, so anybody in the broader community or world can click in. It's students talking about issues they care about, and a lot of the times it's social issues, it's personal issues, it's just anything they want to educate the world on.
I was reflecting on graduation. I want to come back to healthcare because you guys have such interesting parts of your career, but I was reflecting on the last 2 weeks of graduation, and I was remembering so many things because it was holding tight to what was for us, a very, very special year, but of course, special 2 years. But for the five of us that probably, I'm going to start crying. The five of us, our experience in that house probably was a lifetime special year. Well, it was. And so, Laura, I was remembering so many days, and I was reflecting the one symbol of that was that one of our roommates' moms gave us each an umbrella, and they matched, and they had this beautiful art thing on the inside of it, and then black on the outside. Laura, do you remember those umbrellas?
I still have mine.
I love that.
She gave our roommate's mother gave us umbrellas so that we would always have the same roof over our heads.
I love
even
that.
wherever we went in the world, because the five of us just scattered to the wind. One went to London, Catherine went back to Sydney, JT went to Oregon, Nicole went to China, I went to Florida. So we all scattered to the wind, and we would always have the same roof over our heads.
It's really special, Shelly. Where do you live in the second year? Where are you?
I'm in a house with my best friend. So it's also been a special year like that. And we're also dispersing to different parts of the country. So this has given me a great idea for a gift for my friends.
The roof over your head, wherever you are.
I know, I will quote Catherine and Laura's friend's
Yeah.
mother.
Yeah. There you go. There
What a
you go.
beautiful sentiment. And yeah, it's just such a special time where you get to live with your friends. And, I do wish I had lived in a house with more people. I don't think I'm ready to leave that experience yet. So maybe my life after the GSB, I can still have a youthful apartment. But yeah, it's very special.
Yeah.
Where are
Yeah.
you
It is.
going after the GSB?
There you go, Shelly. Tell us.
I will be in Palo Alto, an adjunct professor at the Stanford School of Medicine, started a company that aims to be the Gen AI partner for hospitals and health systems. And so I know you're a physician. I know you operate a health system. So I thought, Catherine, this is a great match. I'm so interested in uh, hearing your perspectives. And so, yeah, I'll be in Palo Alto still.
Tell us a little bit about the
Yes.
job and the company. You guys are graduating into a whole different world, and that's what fascinates me about 30 years apart and what you guys are seeing. And now you're already using a term called Gen AI, and you're applying it to healthcare. And what is interesting about your classmates for me is that you're taking the technology already. And so many of you are applying it to social challenges, be it environment or healthcare or some of the education. I've talked a lot to you. And so tell us about Gen AI. What context, how do you apply it in the healthcare, and what's going to be your job? As if I can imagine what your generation is going to do for a living.
Oh my God, I'm so excited to talk about this. Yes, I'm so excited because I have seen just such a monumental shift in the way healthcare is, what it's able to do, and even what we can apply it to, and what we can deploy it to over even the past 2 years. I remember last summer I was just working on something in digital health, just telehealth, virtual patient care, and I was like, this is where it's at. And now I'm like, the future is much, much bigger. So, what I will be doing, I'll be chief of staff to the CEO of a seed stage startup. And the special part about this startup is the founding team is a group of both physicians and venture capitalists and deep operators. Someone's from Elevance, someone's from one of the health security associations that covers the country. It's a deep bench of physicians who kind of have operated and done medicine and seen all the issues and struggles that hospitals and health systems face, have a lot of deep connections, and started a company to, one, create Gen AI applications, workflow automation tools, interfaces, generative AI, whatever we can do to automate everything going on in the back office of a hospital or health system, starting with non-clinical things. So first, like ambient documentation, just like listening to patients' encounters and documenting and transcribing and making these doctors' notes and putting them into the medical records. And so doctors don't have to write it themselves or even take notes themselves, and it just runs right into the medical record.
You're going to replace the patient bedside? We're going to have robots next to each of the beds in the hospital.
Yeah. And this is the tough thing about generative AI and healthcare. It is such a high stakes environment. Like, you're handling patients' lives and safety. And so it's been such a long journey to even have people feel safe enough or comfortable enough to deploy it into a setting where patients would be able to interact with it. And so the first step that the people who are applying this technology have taken is, let's do things that are non-clinical, that are kind of administrative in nature. And so starting off, the first big application was really on documentation and ambient listening. And so what it really did was just make it so that doctors didn't have to be writing down notes and plugging things into their computers or their little stations while the patient is talking to them. And so typically it's a bad experience when you go to the doctor. They're not listening, they're turned to the monitor, slouched over and typing things in. And now with the generative AI tools that can listen and document and then summarize it and put it in a nice format that goes in the medical record, the doctor is able to be freed up and just be freely talking to you and being assured that it's going to be captured and it's going to be, put into a format that, they want it to be put into. And then they could just, instead of doing it themselves and capturing those notes themselves, just review it afterwards and have all that time to be able to connect with the patient and so on. And so it's a better experience for the doctors. They don't have to do all this boring stuff that they don't want to do. And it's a better experience for the patient because then you get more time and more interface and you feel cared for. And so it's been a long journey, I think, over the past couple of years of finding those places where it feels, one, like safe to do so, and two, like where there's like oversight, where, we're not going to have them automatically do things, but they're going to produce something, like produce a email or a patient message or a document or a billing request, and then someone can either look at it and check it and review it, because ultimately physicians and the hospitals are liable for that. And so that's been a lot of the work that's been going on that we'll be doing. And there's so much behind it. I think the biggest burden in healthcare is all the administrative stuff that you have to do. And Laura, I'm talking as someone who's never worked as a physician, so please, both of you.
Hold that thought, because Laura, you've what a phenomenally interesting career, from going into technology right after school, Laura, to go to Florida. Husband that was developing a huge parcel of land in Florida, and
I have been CEO of the Lancaster Health Group for the last 13 years. But I joined the Lancaster Health Group was a family business started by my father and my aunt in the 80s, and we owned and operated inpatient rehab, skilled nursing, and assisted living, sort of a bucket of senior housing properties. And I worked with my father for a number of years. I became CEO of the company in 2012, and last year I exited from the majority of the company, but we still have one property left that we're still managing and operating. 7 properties over the past 12 years. We exited from 7 other properties: a pharmacy, a therapy company, a home health, a hospice, and private duty nursing company. So I think I've had something like 12 different exits along the way.
you should be lecturing on how to
I
exit.
have only been on the sell side, though. I do not know anything about the buy side.
The technology advances, did you see dramatic change, Laura?
Yes. So when I joined the company in 2000, we were still doing documentation on paper. And when I joined my family, my father said to me, "I want you to join the business. This is a family business, and no one in your generation works in this business. So I've decided it will be you." But he did not. But he said, and I said, "Well, I've been working in technology, and I've already kind of chosen my career path, and it is not this." And he said, "That's okay. You can learn," which is different from "I will teach you."
Right.
And
How's it different?
because he did not teach me, he just threw me in the deep end and said, "Figure it out."
Okay.
And
Okay.
during the first few years, I worked on many projects. Some of them were positive and some of them were not. And so when something didn't go well, then he would say to me, "Oh, yeah, I knew you'd figure it out eventually." I'm like, "Well, that was not a good idea. Why couldn't you have given me a clue that was not a good idea?" But anyway, it didn't happen that way. So I grew up in a different family business, and my father is a serial family business entrepreneur. He started and exited from a number of companies that he started with his siblings, different siblings along the way. And so when I was growing up, he always said to me, "Just because you're part of the family, don't count on this. Go out and get your own life, go get your own education, and go get your own job. And when I am ready, I will ask you to join me. But until then, you're on your own." And so I went to college, went to work in consulting, went to Stanford, and then started working in technology. And I was kind of on my way. And in 2006, he came to visit, ostensibly to visit his grandchildren, and said, "By the way, I want you to join the business." And that's when we had the conversation about, I don't know anything about healthcare. And he said, "It's okay, you can learn." And I decided eventually that it was the right thing to join him. But I really started on the ground floor and trying to figure out where I could add value. And so the very first thing that I did was I looked around and saw that our nurses and doctors were still documenting on paper. And we were the first company in the Midwest to put an electronic medical record system in. In 2006, every patient had a binder, and in the binder, they took notes on medications, when they gave medication, what was happening with the patient. The doctor would come in and he or she would take notes in the binder saying that he had seen the patient or she had visited with the patient and the patient had complained about X. And so the doctor prescribed 2 Advil and so all of this was documented and written down on paper. In 2009, we went live with the first electronic medical record system. So now all of this is in the computer, and instead of a binder, every patient had a medical record that was saved in the cloud. And when medication was administered, it went into the medical records. It was supposed to save just tons of time, but it did not. It took just as much time. It did not save any time because now nurses and doctors had to type, just like Shelly's talking about, and nurses spent a lot more time looking at their computer screen instead of looking at the patient.
So I'm a doctor. I'm going around with a microphone, and it's just fancy taking my voice and putting that up. But what's it generating? Why is it generative?
Great question. There are different areas. Now, maybe I'll tap into a couple of different areas. For the ambient documentation or just like the transcriber, initially it was just transcribing, and even that was kind of difficult. But the generative part that they've tacked onto it has been from these notes and from this encounter that we were listening to, create a note in the format that they should be going into the medical record. And there are a bunch of different standardized data fields, and produce those, input them into the medical record, create what's called a SOAP note. I actually don't know what that stands for. Yeah, so produce a note, and then the doctor does not have to write that themselves or plug in the entry fields themselves. So that's kind of the generative part. It's gone a little step further even, and on top of listening and generating the note, now the Gen AI is kind of reading through and processing the notes and even starting to recommend, specific things that doctors should do, specific treatments, interventions, or medical things to kind of support the clinical decision making. It's not yet saying like, give them this medication or give them this procedure, but it's sort of the first step is kind of supporting, maybe schedule this person for an appointment because they have this risk factor or they have this disease and you should be seeing them every couple of months or so. And so it's evolved, and the generative part is getting more and more. It's getting closer and closer to patient care, although it's not replacing kind of the doctor's ability to.
I'm going to go back, Laura, just a second to the extraordinary circumstances of COVID that you led through, because that was people leading through something that technology could never have addressed. Describe that to your generation.
Yeah, I think we are transitioning from just physicians and nurses and other clinical staff and administrative staff doing everything themselves to them doing the parts of medicine that they like, the patient-facing work, the meaningful work with AI help. So I kind of see it as all the things that go on to support a patient, like scheduling a patient, following up with them, making sure they show up to their appointment, conducting outreach and telling them, hey, did you take your medication today? Did you follow your post-procedure orders? Did you follow up on that referral, or did you go schedule that appointment? So it's going all the way from even just scheduling and checking the eligibility of a patient to getting them in the office and supporting the documentation around that, supporting the billing of that, and supporting, sometimes you need to get insurance's permission to provide specific treatments or medications. And so you can automate that really painful process of like finding out all the insurance's rules and figuring out all the specific data fields that they need and putting together those forms and then calling the insurance company, waiting on that phone line to get to someone to talk to and blah, blah, blah. So really automate all of those aspects. And there's a lot of generative components to that, even with like something as easy as scheduling. Sometimes, the previous electronic scheduling we're kind of used to as a patient goes in there and clicks and sees a bunch of times and is like, okay, I'll pick this one. But now it's generative in the form that this patient can be like, here's my need, here's my availability. And then the Gen AI can then say, what's the severity of this patient's situation? What provider do we match them to? And who's available on that day? Where should we send them to? And so on and so forth. So doing a lot of the smart stuff in the background because, the health system, just its capacity cannot handle all of the health needs that we have today, at least not efficiently and effectively.
Over the last 13 years with your doctors, your allied health, your back of the house, your nurses, you talked a little bit about technology, but the human element in those 2 years especially, and I do have some tears, I watched Laura from the distance dealing with something like COVID for the 2 years that it affected your system. So now, Laura, tell us a little bit about those 2 years, because the last thing you're probably thinking about is the electronic systems of recording. Those 2 years were really about your people. It'd be interesting to reflect on leadership and what happened during those 2 years.
Leadership, COVID was a terrible time. It was really 2 years of trench warfare. And I was not sitting at home on Zoom baking bread. I kept joking that I wanted a job in marketing, but what I was doing, I worked 7 days a week, 24 hours a day. We were initially trying to get enough PPE to protect our staff. We were trying to learn as much as we could. We were trying to learn about the virus, learn about ways to combat the virus, to keep things clean. We never expected, I did not expect that we were going to get help from the outside or from the government so that we would have to manage it all by ourselves. I also did not expect the government to impede us from taking care of our patients, but that was also part of what happened. And I also learned that we made friends in the most unlikely places. We didn't have enough gowns for our staff. And so I met someone who had a business sewing patio cushions, and the demand for patio cushions dried up, but they were able to get some very high-tech fabric, and we designed our own gowns, and we started manufacturing our own gowns here in Chicago. I had friends that were helping me get PPE from China, but at the time, the state of Illinois was seizing PPE from skilled nursing facilities to give to hospitals, but our staff needed them just as much as doctors and nurses in hospitals. So we were shipping PPE around the world via Istanbul through, I was basically smuggling PPE into the country. And some of our PPE came in labeled as something else so that no one would know what was in the box. But it was my job to care for my staff so that my staff could care for our patients. And so in order to care for our staff, we had to have equipment and PPE, and a community of people in Chicago used their 3D printers to print face shields.
Face shields by 3D.
Face shields. Wow. Used 3D printer to print the piece that attached to your head, and that you used elastic, but then you used a clear plastic sheet, just like a plastic sheet like a binder sheet, to be the shield in front, and then we used a 3-hole punch, and we punched the holes, and then it would attach to the 3D printed sheet. I still have them in my basement. They were made by a community. They were made by our community and they were given to us, and they were for me, they are just a symbol of what human ingenuity can do. And someone from a university came up with the design and basically circulated the design on the web for free. And people with 3D printers started printing them. I think the other thing that was really important during COVID is sometimes you had to be real and you had to be very honest. And you had to say to your staff, I don't know. I don't know what's going to happen. I don't know what is the right thing. My best idea is X, but if that's not the right idea, we will have to change. And I think that is not something that you learn to do really easily. And in healthcare, it's not something that you say very often. People don't like it when you say, I don't know. But I don't know sometimes is the only thing to say. And I think it is important to show that you're human, and you show your staff that you're human. The other thing I will say is that you must use your mind, and you must count on reason, and you must count on science. And no matter what you want to say about our our current the current view on the COVID vaccine, I will say that before we received the COVID vaccine, 70 of our patients passed away. And after we received the COVID vaccine in January of 2021, not one patient who wasn't already on hospice passed away from COVID. So you can say whatever you want about whether or not the vaccine works or not, but I believe the vaccine works. And I also believe that the science shows that the vaccine works. So and ivermectin does not.
Yeah. And Laura, so that's the technology that we're talking about is the medical technology and the back of house, as you're saying, Shelly, that technology. Will you guys start looking at how, like your company, looking at how Gen AI, Shelly, supports that medical research and the medical technology application in the health systems?
I think it could. Before it was just Laura, and so much admiration and just sadness that you had to go, and all the hospital workers and healthcare workers had to go through that, and there was no support from the government and limited support from just people around the US just not wanting to do basic things to help protect other people. It just was horrible. I have a friend, one of my best friends was a nurse during that time too, and just seeing all of that was heartbreaking. I think there is really good applications for that. I think when it comes to PPE now, obviously we've done a lot to change manufacturing and bring that, and I'm sure of that, but I think the back office application would be within procurement and the supply chain, and making sure that there is less time spent on one, doing those tasks, and then two, being able to predict the need and the volume that's needed to make sure that orders are always fit. That's what I would think. I don't know. Do you have any
So Shelly, a little bit more personal note. So what is it about the healthcare role? And is that something that you knew all through the 2 years of studying that you wanted to go into?
So I started off after high school wanting to go into climate change and conservation, and I did a lot of environmental activism and organizing and worked in renewable energy, just because I felt like that was the biggest, most pressing issue to tackle with the biggest impact. Realize that's really hard to do. Long time, it's hard to do anything that you can see the impact of. So then I zoned in on healthcare and was like, there are so many issues here, and there are really bite-sized problems that you can take on and make an impact immediately. And so moved into healthcare. I also had a personal experience with the healthcare system. My mother was diagnosed with cancer and had a 5-year battle. And this was a time when we were low income, we were on Medicaid, and eventually as her disease progressed, she was on Medicare. But before that, we were on my dad's employer sponsor insurance, which was really bad, high deductible, and the network was very narrow. And so experiencing that, I was 20 years old, just kind of calling health insurance and being on the phone for hours and hours, going to the doctor's office, and there would be 15 patients scheduled for the same appointment slot. So even when you arrived at your appointment time, you had 4 hours to wait before the chemo even started. Then you had 3 hours to wait for the chemo to get done. And, we just didn't have the ability to access good treatment. We didn't have the ability to even know how to navigate that. And there's not a lot of agency within the healthcare system, particularly for those most in need, those the sickest ones, most vulnerable ones, the elderly, the low income. And so when I moved into healthcare at my consulting firm, I actually had a great chance to do a lot of work that meaningfully impacted Medicaid and Medicare patients. I spent 2 years kind of building a new insurance product for uninsured people to get access to primary care. So that was a really special experience. And so it's just easy and nice to see the impact you can have immediately on patients, where there are millions of patients out there with their individual stories. I know how painful my mom's story was as a patient. It was the biggest event, most traumatic event in my life, changed the entire trajectory of my life. And so just being able to impact one person is huge, and being able to impact many is pretty amazing.
Really, to be able to take that whole life experience and translate that into a career, and always have that in the back of your mind. Gee, that must be special. I hope that, your mom is, well, she would be in your heart every single step that you make. But did you go into Stanford, for example, and say, yes, I want to continue in this, and the reason I'm doing this is X? So
Yes.
how did your thoughts evolve over those 2 years?
Yeah. So prior to Stanford, I was working mostly in the health insurance and hospitals and health system space. And then there was a big revolution. Telehealth and virtual care was becoming huge. So I wanted to tap into that and also explore other parts of the healthcare ecosystem. It's pretty unique that if you work in healthcare, you can be doing such vastly different things. You could be developing drugs all the way to, providing care. So for my 2 years, I just took the opportunity to work with all sorts of startups. I even worked at a pharma company in Japan last summer.
Did you really?
I did. I just wanted to see everything and see what, spoke to me the most. And then when obviously AI, the frontier models got a lot more smarter and there were a lot more capabilities, I was like, I'm so honored to be at this moment in time where we have a real ability to make a lot of change and I can shape that. And so moved into, the applications to the back office of hospitals and health systems where most of the care happens and occurs. And the special part about my company is that's the main question that, doctors and health system executives have is how safe is this really? How much can we trust it? There's a lot of error in this. And so my company, our special differentiation is that we have a platform for model monitoring and evaluation and observability, which is a term that means every decision or output that the Gen AI model has, we can trace the reasoning steps and trace where they got this information from. So it's not just a black box. We're not just feeding bad outputs into patient care, but that we're actually having really robust security and monitoring tools to do that. And so I thought it was a really special and unique opportunity. I took the class of this adjunct professor in the med school, and he was one of the first ones to have a course on Gen AI in healthcare. And he, had a security and monitoring background. And so he started this company and I just thought, wow, that's going to be the future. And so, yeah.
The lessons you had on that when it didn't have an impact on the healthcare, on your company the way you wanted to, and the staff, are some of those lessons still applicable to this new application of technology, Laura, do you think?
I'm sure that they are. I'm skeptical. I'm a skeptic that it will reduce, time spent. I mean, not 1 minute was saved in creating, it was just spent differently. So in nursing time and doctor's time was just spent differently. And I think the other thing about creating, and I think you'll face the same issue with the generative AI, is so now we record everything, but we have lots of data and no information. And that does not help. It doesn't help a doctor make a decision when every and of a conversation is recorded. And so, how do we actually get information out of what came from the conversation and the conversation with the patient? So, and I'm a skeptic because I have not seen it happen yet. I was promised that I would reduce my workforce by, 25%. Yeah, no, not. In fact, our workforce grew, it increased. And at the end of the day, did our care actually improve? I think our knowledge about what we did for our patient probably improved, but I'm not sure that our day-to-day care actually had that much of a change. And that is really, at the end of the day, are we actually making a patient's life better? Are we improving their outcomes? Are we actually providing higher quality care? That's the question. Did we make money? Did we farm the federal government? Did we find a way to bill Medicare for something that we couldn't bill Medicare for before? Those are the realities of what happens in healthcare. But did we actually make someone's life better?
Well,
Because we aren't always saving anyone's life either. We are just extending someone's life in a way that their life was extended with quality. Did we extend their life so that they could have more joy or more time with their family? Or did we extend their life so that they could spend more time in a coma? These are the questions that face people in healthcare.
Shelly, have we made that life of the patient and their family better than we did, say, 30 years ago when we were graduating and going into healthcare around her? So it'll be interesting to keep it real for you. Will you be having exposure to patients and healthcare, or are you kind of, yeah.
I'll spend a lot of time in the hospitals and health systems working with them. And I love Laura, like, incredible perspective. Even I think the latest studies, I think Kaiser Permanente did a study recently on the Gen AI tool that's been listening and transcribing and doing documentation, and tried to see if it actually saved doctors time. And it actually was, for each note, they saved like half of a minute. So it wasn't huge at all. Like, it was, vastly disappointing. And I think that's the immense challenge here is we've got this awesome technology, and, like, how do we make it effective? How do we make it actually change a patient's life? And, I've been impressed by kind of some of the more aspirational thoughts that we have out there. There are a couple of companies out there that are doing conversational AI, and what they're doing is thinking of a world in which they can call patients on the phone, and, you don't need a workforce for that. You can call 100,000 patients in a day and ask them, hey, did you do your colorectal cancer screening this year? And, talk to them on the phone, stay with them on the phone for even 30 minutes, an hour, whatever it is, to listen to them, make them feel heard, and convince them to go get a screening. And then, if you catch colorectal cancer early, you can really be cured, versus if you catch it later, then your lifespan is probably highly impacted. And so it's those kind of aspirational applications of the Gen A that I'm really excited about. I think we're absolutely not there yet. We're still not even there where we can do that. But in those cases, I'm hopeful that might be able to make a difference. But I think you're right, all the unsexy parts of, let's automate documenting, let's automate billing, or all these, exploit the loopholes in the system. It's so tough, because that's probably what is going to happen. But I that's why I enjoyed my company's founding team is full of physicians. They all were practicing physicians at one point. And so they've got not just the business perspective, that's my perspective. I don't have Laura's rich experiences, and the experience going through COVID and just being on the front lines is so different. And us on the business side, like, we come in and we don't really know what's going on, and we're trying to force fit this into this mold, and it doesn't always work. So I have such respect for my founding team, and feel like they have the differentiator that might, mesh technology and actual patient impact.
Laura, you 31 years ago, graduating from Stanford. One or two things that we wish we could have told ourselves in graduating. What would we have told ourselves, Laura?
The most important decision that you make will be the decision of who you marry. It is actually not your career. It is not your life. It is who you choose as your partner. And that is the most important decision that you make in your entire life, and is much more important than the decisions that you make about your career. The decisions that you make that you are proud of, and the people that you love, and the people that love you in return. I think the other thing I would say to myself is to be present in my own life, to inhale and to exhale, and to savor the moments instead of rushing pell-mell for a career or a promotion or a bonus, or those things actually don't matter, but to savor the moments, and to be forgiving of yourself, to be forgiving, because you will make mistakes, and that's okay. And careers are not straight lines, and that's okay too.
What are you savoring right now, Laura? Speaking about being present, like at this stage, 58, last of 3, graduating high school.
I'm trying to savor Isabel. I'm trying to savor her coming home from school, sitting at the kitchen table, dumping on about her day, carrying on, being excited about the Women's Professional Hockey League and her plans to go to college and, take on the world. I'm trying to savor just listening to her. In the next few days, both my sons will come home too. And these are the good days. And to be able to say these are the good days, because the bad days come.
Shelly, what's your advice to us?
It's so funny because right now I'm taking a course on longevity and the opportunities and, the different how society will be shaped differently by this really awesome professor who's in biotech, Robert Chess. And what the lessons that stuck out to me during that were really just how much power and wealth is currently held by the generation above us. And, with longevity advancements, I think we'll be living longer, healthier lives far beyond our imagination. And so I think companies, businesses, and industries are really turning towards how do we cater to kind of those demographics and your demographic and middle-aged and more senior management and executives and so on and so forth. So I think there's a lot of consumer power and the ability to vote with your dollar, because you will be the largest demographic in time, not yet.
Oh, getting there.
Oh my gosh.
Very
no
close.
worries. You guys don't look a day over 40.
Sure.
And so and there's a lot of power in that. I think there's a lot of choice with what to do with the accumulated wealth at the end of life. So just wondering, what social purposes you guys value, and hope you're exercising the immense power that you wield, as opposed to, I guess, my generation is worrying about, will we have houses? And not myself personally, but obviously people who are in less privileged positions and not at Stanford. Will we have houses? Will we be able to wield any create any wealth, and so on and so forth.
My wish is that we could not only share those mistakes, but also share what worked. And so much of what I've learned, so much about what I learned about people. Last question, Shelly, is so back to Laura's savoring. What are you savoring right this minute? Like
just the moments with people, one that I love and are close to, but also people who I have only talked to maybe once or twice, and I'm not going to have that opportunity to bump into them in the cafeteria or whatnot, making sure, the place I'm going to, it's not urgent. I can stop and chat for the 15, 20 minutes that make kind of the moment's so serendipitous, and you can form such serendipitous relationships. So just experiencing, the wonderful class that we have on the Stanford campus, and the professors are wonderful, making sure I get to spend some time talking to them and learning about their experiences and their wisdom. And living in this current moment.
Thanks, Shelly. Thanks, Laura. I really appreciate this conversation deeply. Thank you for joining us. For more insights and information, visit my website at katherinemclennan.com. That's spelled KATHARINEMCLENNAN.com. Don't forget to subscribe to the series so you know when the next episode will be, as we continue exchanging wisdom, connecting past, present, and future through the perspectives of Stanford MBA graduates of 1995 and 2025.